right, here we are. We're back for part two. And Dr. Tanios is back with us. She's here for the long haul. And joining us, we have Dr. Michael Smiley, a pediatric pulmonologist and associate program director of pediatric pulmonology and part of the complex care team. You got a lot of titles.
Makes me sound important. Thank you.
You do sound important. And we also have the Watson family. We have Rose and Demetrius and the queen herself, Miss Lavender. So welcome, everybody. Thanks for joining us.
Thank you guys for having us.
Awesome. Okay, Dr. Smiley, we're going to start with you. And before we get to the queen, so tell us about you. How long have you been with Glennon? What do you do? And why complex care?
Okay, a lot of questions. So remind me if I missed some, please.
Okay, so the first one is, who are you?
All right. So I'm Mike Smiley. I'm a pediatric pulmonologist, as you mentioned, and I wear a lot of different hats in our hospital. Complex care is one of them. Going back to when I joined Glennon, I came here after 15 years in the Navy. I came back from San Diego in August 2019, so I'm almost at my 5-year anniversary here.
Nice. Congratulations.
Thank you. It's welcome. A St. Louis thing, and we boomerang back. So, and so I had to follow the script, but no, I've been happy to be back.
Nice. Okay. And why complex care? Why is that a passion for you?
Right. Good question. So prior to joining the complex care team here, I think I joined the team in 2021 to replace Dr. Tanios when she moved on to other ventures. So they could not put us in a meeting together. So I only had to go after her. But I had experience in a similar type program in San Diego, and more by just nature as a pediatric pulmonologist that took care of a lot of children with tracheostomies and ventilators. And then it just so happened that I had a really strong nurse navigator I was working with at the time, and she wanted to coordinate everything. And so I became like the default complex care physician there, without all the robust resources that we have at Cardinal Glennon. It's a little bit more bare bones, but really developed an appreciation for that patient population. It's a very diverse group. And when Aline's opening came up, I said, "Hey, Dr. Sobish, I would love to be part of this program." And so it worked out.
Love that. And you are currently Lavender's quarterback for complex care, yes?
Yeah, I'm the backup because, Dr. Tanios is still around.
She's the OG.
And as you saw in the entry, Lavender went to Dr. Tanios first. I'm used to that. I'm a dad. My kids always go to my wife when, they get hurt. So it doesn't hurt.
Okay, we're going to pivot to the stars here. Okay, Rose and Demetrius, you get the floor. You have had a 7-year journey with Miss Lavender and with us. So can you go back to the very beginning and tell us about your pregnancy? We'll start there.
Let me say something real quick. Before we get into that, and before we were lucky enough to have Dr. Smiley, who I didn't know, the Navy background, that's incredible. And it kind of speaks to how good you are. As a lot of times we'll come to these appointments and then go home and do what everybody does and discuss it and see what it was like and talk about people and be rude. But we were very blessed and lucky. Like we literally, and I very seriously mean literally, would not be sitting here without these two amazing, brilliant people to my left to, I don't want to say pilot and co-pilot, but to work together to get us to where we are. Because if had Dr. Tanios ever taken a day off, a note off, a moment off, or not cared as much as she did, she would have been able to provide the information that we needed for Dr. Smiley to step in and be where he is for her to make it here to be 7. So I'll let my wife kind of go into I have a rough memory. So like the dates and times and all that, I just kind of remember like the feelings and the way I like kind of would look at certain people and deal with things. And go ahead, baby.
And a lot of it is a blur looking back, but okay. So we really struggled with fertility we had a almost 8-year-old daughter. So whenever we found out we were pregnant, we were so excited. And it was really one of those, when we told everybody, like, magical, everyone's crying. They were all so excited. And then it was like that appointment where we went in for like the genetic testing. but you're really going for the ultrasound because you just want to see your cute baby. And we were all so excited. And it was the little room that they bring you in to get the blood work. And they just talk about, your baby could have this, but it's really rare. She said, 1 in 600 babies has Down syndrome. And I remember being like, whoa. And she goes, doesn't that sound like a lot? And I was like, well, no, I have 600 Facebook friends and not one of my friends has a baby with Down syndrome. So I think in that moment, it was kind of like, I already knew what was going to happen.
That exact moment when she said that, we were sitting there. I thought 1 in 600 was like good. Just like if someone was like, you have a 1 in 600 chance of hitting the lottery right here in this room, everybody'd be like, oh, wait a minute, now that's kind of close. But she knew then. She was like,
social media makes everything seem so small.
And I'm like, don't exist on social media. So for me, I was looking at like 1 in 600 as in like 600 people in an auditorium. And I'm like, that'll be slim. She is looking at it like, sick. That's something to be alarmed. And she was right, as she always seems to be. So
then we went in for the ultrasound, and it was that typical, gloom moment where she's not saying anything. And so she just like quickly left and then came back, and the doctor, did the ultrasound, and it was, like I said, all a blur, but there's thickening of the nuchal fold. I'm like, what is that? It could be it's not your fault. And the room's just spinning. And Lulu's there, our 8-year-old, and I'm trying not to be upset, but and so then after that they said, well, we're gonna figure out the results, and this is like a holiday weekend too, so I'm like, it's gonna be even longer. And yeah, that was the worst drive home, and then the worst 4 days that we had to wait. And then sure enough, they called and they said, she said, are you sitting down? And I was at my uncle's shop, like getting something done to my car. And so I found a chair. And, she said, I don't know if you looked this up whenever I told you the things that your baby might have, but the baby does have trisomy 18. And I think sure enough, I was Googling those days because I wasn't even leaving the couch. And all I remember is her saying, the baby will have, liver problems and feeding problems and heart problems, and most likely will, and these babies don't even make it till their first birthday, most likely. So I'm just so upset. I get off the phone with her, and my uncle's hugging me, and he's like, oh, she's going to be fine. Or we didn't know she at the time, the baby will be fine. And yeah, it was just, I don't even remember the drive home. And then from then on, I went back to my OB, and that appointment was, I don't know if I won't go into how much
it was horrible
negative things, but it was really no hope whatsoever. The only thing she really offered was an abortion, which I just personally, I was like, no, I can feel my baby kicking. And she just said, babies with trisomy 18 don't survive. And she went on to say blah, blah, blah. And she's handing me this paper, and then I'm looking at it, and I look at the bottom, and it says sex, female. And that was, I'm going to try not to be upset, but I remember saying like, oh my gosh, my baby's a girl. And she was like, oh, is that what it says? Because to her, she just wanted to, I'm glad these are right here.
She was just going through the motions while
I noticed this before I walked in. I was like, I'm so glad those are there. But she said, oh, is that what it says? Because for her, she just really wanted to tell me, like, at that appointment, this is what your baby has. It's so early on. You can still do this. And she's like, you can have other babies. And so I just left that appointment pretty much on a mission. Like, well, I'm going to find a doctor that's going to support me and at least let me have my baby, and then we'll just go from there and we'll figure this out together. I just immediately felt so protective over her, and I really felt a strength that I've never felt before, because I don't want to say I have lacked confidence, but being a mom is just like my greatest joy. So whenever somebody tells you, I'm sorry, guys.
The other level to this is that Lavender's is like the baby we tried for. So we were like, okay, let's do it. We did it. I was 33. I was
29. I wasn't in my 30s yet. I just wanted to make that.
So I was
said
33.
mid-30s, and I said,
You're still 29, Rose.
actually 25.
Anyway, so from 33 to 29.
So you start seeking people who are going to support you through this journey.
Did, yeah.
Thank God for the internet.
Man, it's a nice thing to say.
Well, I think there's so much bad, but
never hear
there's
that, right?
no, there's so much good, especially whenever it comes to like medical moms. We're a little crazy, but it's good. So I think I just put the word out. Like, I didn't want to share her diagnosis yet because I didn't want people Googling, because I wasn't even ready for that. So I think I just said, like, I have a high risk pregnancy. I am looking for a doctor. And I had multiple people reach. We can hear that lavender smooch. Multiple people.
Lavender needs lots of smooches. She deserves all the
Multiple
love.
people reached out to me, and they all said, you have to see Dr. Paul. And once we met with him, it was finally like we had hope. And that was really all I wanted. I just wanted somebody to, like, if she was going to pass away right after birth, that was fine. I was okay with her diagnosis. I just wanted somebody who was going to still let us be excited about our pregnancy and still love our baby. And yeah, and so once we started seeing him, and we had these like amazing long appointments, and he was just, you know, we went into it still like it was a typical baby, and we got so many ultrasounds, which I loved. And I think one of the first signs of hope was just, you know, a lot of times babies with trisomy 18 have these little clenched fists. And in one of her ultrasounds, she had her hands open. And I just thought, like, oh my gosh, like, yeah, she's fine.
So delivery happens, and there's no big, huge red flags and emergencies.
Well, so, you know, directly after, we didn't want to do really any medical intervention.
Mm-hmm.
We just, everything we had heard about trisomy 18 was very, you know, they'll live for days or weeks. So we thought, if we're only going to have this short amount of time, we don't want to send her to the NICU. We want to just bring her right home. So that's what we did. And I was just like, I mean, I don't think I've ever been happier, because when someone says your baby won't do this, and then they just start doing these little things, I mean, you feel like just euphoric. So we brought her home, and she was 4 pounds 7 ounces, and the cutest little tiny, I mean, we always just said like her head was just like so tiny. And as soon as we got home, you know, it was kind of like reality of, then the hospice team came, and I'm thinking like, she's doing so amazing. Oh my gosh, she defied all these odds. And they were like having us sign things and saying, oh, you know, it will probably be, you know, while my other daughter's sitting there, like, it's probably going to be about 7 days. And so then from then on, every day Lulu would go, well, we have 5 days left. And then she'd go,
Oh, man.
well, we have 4 now. And I think one of the hardest things in that situation is like, then to explain it to your other child. But sure enough, 7 days came and went, and she was just doing great. And then we eventually, I think my mom, because I think us moms, we're tired enough after we have a typical baby, but when you have a baby that you're like watching to make sure they're breathing, it's even more intense. So my mom said, I think she needs a feeding tube, Rose. I don't think she's eating enough by bottle. And so, yeah, truly. And so that's whenever the hospice nurse taught us that was my first little introduction into the medical world, because before that I was like, oh Lord, I don't even want to see somebody getting their blood taken, so now I got to put this tube down my baby's nose. But then once she started getting this nourishment, we were watching her grow little by little. And yeah, so being on the hospice team was like, it was tough, even just to say like, you have a baby on hospice. You don't get to have those really fun beginning weeks with your baby.
Because
like just cuddling.
Like we were saying, and even from the beginning, we tried for this. So we did that with the fact of having in mind we'll be able to plan all this stuff. You know, like, okay, we have the baby shower, we have this, and we'll have this coming up. And instead, we have her, and it's a day-to-day thing. So, like, we don't know whether to buy car seats or strollers.
We didn't buy anything.
We didn't. Well, it's like your heart's really bad in your brain now. You want to hope, like, you know, that it's going to work. But your brain and this sweet, sweet person from hospice is telling you, looking at you like this. Nah, you know. And you would, all people in those positions don't understand their position of a leadership position of understanding that knowledge and what you spew is very important, like extremely. But even at that, you're still going to make a mistake. So it's not their fault. We're all human.
No, it's their job. And I'm sure they've seen a lot of babies that have passed away.
Right. So that's a characteristic
and that's what
too.
We've learned though. And that's kind of whenever the medical intervention, first I thought, oh, we'll choose life. But then the medical intervention or no medical intervention, that was a really hard decision for us too. But we've always kind of just said, we'll let Lavender lead the way. And as days were passing and then weeks, kind of like, oh. And then once we got introduced to Cardinal Glennon was when she was 3 months old, she got sick, which nobody wants their baby to get sick, but it actually turned into like the biggest blessing.
So tell us about how you got introduced to Cardinal Glennon. So you're at home, you didn't know that you'd even make it a week, and then another week passes and another week passes, and then she gets sick. So how did you find Cardinal Glennon? How did that all go down?
Well, you know, my aunt actually has worked here for 50 years.
Marsha, I love you, man.
Yeah, Marsha. She's worked here in oncology for...
I forgot that.
So we've already...
Stephan?
Yes.
It's my dad's sister.
my
So we
goodness.
already
forgot that.
were a
She's
Glennon
amazing.
family before we were.
Did you not know that?
No, I did not.
Yes.
It's my auntie. Yeah.
Oh my gosh, I love her.
Right?
I just
Is
texted her
that
this
not
morning and I said,
crazy?
have you been there 30? She goes, I've been there 50 years. And I was
Yeah.
like,
Wow.
Yeah.
50 years.
Yeah.
Beautiful.
She needs a big old party.
Yeah.
But she's not going anywhere. We're not going to
Yeah.
let her. We're not going to let her. Anyway,
So
we digress.
we had already
Okay.
known about Cardinal Glennon. And I think we brought Lulu once when she was little, which she actually wasn't sick. She was eating fries and ketchup in the ER. But anyway, so we actually met Lillian here. So another Trisomy family. Whenever Lavender was probably maybe 2 months, we came and we visited them and we had the girls together, and that was really our introduction. So I just thought, oh my gosh, what a blessing, because they live about 5 hours away. And I'm like, well, if Lavender ever needs something, we're only 15 minutes from a great hospital that actually is trisomy friendly. So she got sick. And yeah, there wasn't even a question where we'd go. We just rushed right into the ER. And I think we knew she was sick, but we didn't know how bad it was. And we brought her in, and there was no like waiting. Like they saw her and they just rushed her back. And it was a question of like, do we intubate? Do we just do like high flow? Like, what do you guys want to do? And we're like, oh my gosh, we
It's
have
such
no
a
idea.
it's just a beautiful place. We especially at this point, like we go back and forth, but even then, like having everything is kind of coincidental. I think it's kind of like I told Rose, I think it's kind of like a joke that everybody thinks they have this much control in life general. But like, so we had her and this hospital was here, and it all kind of lined up to like work out, because even now when we talk about moving, we can't really, well, we could, but it'd be a lot more difficult to move
We still
because this
travel
hospital
here.
is that special.
I think that that visit too really showed us like, oh, babies with trisomy 18 don't just die. Like, I think that's what I always assumed. And it's like, once you treat these individual problems that each child has, like one baby might have a heart defect. For Lavender, she obviously has struggled with breathing and her feeding difficulties. So I just assumed like they would die. I never even thought about, as somebody who's not in the medical world, like, oh, once we treat these. So once we came, and then we met with Dr. Tanios and the complex care team, and they kind of said like, do you want her to start going here? As she got better, you know, we went from the PICU to TCU, and we kind of started this plan of let's address each problem. So breathing, eating, and then she could thrive after all
Which
that.
we would have never even known if it wasn't for Cardinal Glennon,
Yeah.
because to have someone, or a team of people slow you down and let you know, like, hey, you know, this car can work.
Mm-hmm.
Right. It just needs it needs this, it needs this, it needs that. Are you okay with that? We didn't even, when we discussed it, when we were just being home late at night, we would say, you know, well, my wife was way ahead in the sense, and we'd be like, you know, do you want to do complex? You know, do you want to intervene? And I'd be like, would you want to be intervened? Which was a stupid question. And we would go back and forth and realize, but once we got here and they were able to explain intervening and what that looks like a little more to me, mm-hmm. it was beautiful. And just the fact that it's just too many coincidences for it not to be heavenly.
Mm-hmm. So there was that admission, which was the first kind of scary one, mm-hmm. where those conversations about intervening medically happened. And what does that mean? And what kind of decisions are we going to need to make? And there was a lot of respiratory decisions. So was it that admission where you guys mm-hmm. met up?
The very first one. Yeah.
So you're in the ICU. There's a lot going on. There's a lot of decision making to be made. And Dr. Tanios throws you a rope, so to speak. Mm-hmm. So talk about that. You can talk about that, Dr. Tanios.
Yes, I remember that vividly. And I think when she got transferred to TCU, she was in room 3301, like at the end of that hallway. And the team said, you know, we will have like a family centered round. We were standing in the hallway. And some of my residents said, they start presenting the medical stuff. And I think one of my residents said, hey, Dr. Tanios, just want to let you know that Mom will have very hard questions. And Lavender got discharged after birth from nursery on hospice and all of that. So I'm like, so what do you mean? Is she on hospice, not on hospice? Because, you know, sometimes if this is a decision that the parents have made, then you have to respect that. Anyway, I walked in, I met Miss Lavi and I met Rose, and I'm like, okay, let me, you know, you read the room, and we immediately bonded. She asked all her questions, and I didn't, it's not like I had a magic wand. All what I said, as Rose just mentioned, is that we started dissecting each problem. So we said her active problems right now is that she has a common cold, that some kids stay home, her being 3-month-old threw her off, she's on oxygen and all of that. We're going to address that. Then we'll talk about 1, 2, or 3. Then I think Rose, and correct me if I'm wrong, I think Rose said, I mentioned something about hospice, and Rose was like, no, I want to do everything. I said, okay, that's a different game plan then. So 2-3 days later, Lavender did great, off oxygen, was on the NG feeds. So that's when I introduced the idea of complex care. And I said, it's not mandatory, it's up to you, you decide, but we will be the liaison between whoever else you're seeing, and then we can answer your questions. But again, put it on your radar. And I think that's how it started.
So I'm trying to paint this picture. So we have a scare, right? That's the first time we have a scare, and it went okay, you know, theoretically, but it's a scare. And there's discussion, I'm assuming, like, okay, the next time it could be different.
Yeah.
And this might be what we're looking at. So is that part of the I'm going to call it the benefit of having those discussions early, right?
Yes.
To be able to have a plan so that I hate to say the next time, but the next time we face a scare, right?
It was never a goodbye. It was always
no,
I'll see you.
Yeah.
Yes. And it was like, you know, again, Lavender, this was her first year of life. So all kids will be sick every month, every other month, here and ear infection or a common cold, or I mean, you name it. So we were treating her like she's going to be sick regardless. And it was actually, I think it was around like winter season. So it's not like, you're hitting the high season.
Right.
So, and I think I start seeing Lavender in clinic the first time. And that's when you start looking at the other pieces. Okay, now that she's stable, healthier, we start looking at like, she's not growing well. She's not feeding this way. And so slowly but steadily. And every time you're introducing something new or like another medical intervention, these two people never question. I mean, like literally they trust. I mean, when they trust you with their own child, you are so humbled and you really want to meet their expectations. Not that you have a magic wand, but you can, like, I remember when we talked about the G-tube. So that button that you feed the kids their formula through it, because Lavender was at risk to not able to swallow freely without aspirating through her lungs, to her lungs. And what's that? And I'm like, listen, this is the easiest thing. And then like you start, I said it's easy compared to, and if you ask Rose right now, was that easy? Oh yeah, it was, compared to all the other procedures that Lavender had. Was that all the time easily made decisions? No. I will mention one time, this was the scariest one for all of us, and it was really shaky. That's when Lavender had like a abnormal vessel in her airways. And I remember she was in the ICU. We were all scared. I mean, I did my best to pretend like, this is no big deal. Oh, but it was big deal. So I would go outside. Demetrius would be in the ICU waiting room. Rose will be at the bedside, will not leave the bedside. And I would go with the ENT doctor and then would listen, trying to buffer some of this information. But I mean, there's really nothing to buffer. I mean, Lavender she goes to the OR, it's life or death. There wasn't like anything else. So I would go to the waiting room where Demetrius is, and Demetrius is upset. He's upset for the whole situation. He's also upset because Rose is devastated. And I remember him telling me, can you get her out of that room right now? Because she's driving everybody else crazy. Then I would go back and say, hey, Rose, do you want to go home and take a nap? And it was, I don't know, now I'm talking and like we're smiling and laughing, but it would be, you become part of the family.
Well, yeah.
And it takes, like I said in the previous episode, it does take a toll of you because you're on edge. Are they going to page me now? Something happened? I mean, yeah.
So tell me about that day.
Mm-hmm.
So that's a life or death
Was that
situation.
the intubation day?
Yes.
Yeah, that was whenever
And you're playing go between. So
yes.
you know the.
Oh, I played go between between both of them all the time.
Yeah.
Well,
she was always.
He was in the waiting room with Lulu, and like she said, they brought her back. So it was finally like she either has to have a trach, or maybe today's to say, the day we say goodbye.
Yeah.
And I think we just were like, we'll just try. And he brought her back, and Lord knows how long it had been since I had like taken care of myself. So I went to take a shower, and I think they called, and they're like, and they had just brought her back, and he goes, I'm going to try, but like she said, there's
she was at high risk
vessel right here.
Yes, at high risk
artery,
to bleed.
Yeah,
yes.
And he said, and we can see it.
Mm-hmm.
And he's like, well, we'll try. And I was like, okay. So then I think I just went back to the room, and you guys all came, and then we just waited, and they were in the waiting room. Yeah.
That day was.
This was a very rough admission.
One of the worst.
Yes, one of the worst.
So there's those are heavy decisions.
Mm-hmm.
So she was intubated at the time, or
yeah,
no? She was,
and
it
she
was
had just so
deciding
much
whether or
stuff.
not to get a trach.
Yeah. And she was coughing, and then what happened was it came out, and so it was the room got filled, and I think the wrong alarm was pressed, so it went throughout the whole hospital instead of just the PICU. So everybody was alerted, and people that I knew on other floors knew that it was Lavender too. So I think the room was just filled, and he was just coming back from work. So he's in the hall, and he's like, what's going on? And it's just one of those very, TV moments where they're pushing on your tiny baby. We're watching her heart rate and oxygen go down. And and I'm like, can you do a trach right here? And Dr. Costa's like, well, we can bring her back to, it was just, so then once they got her re-intubated, it was terrible. So that was really the moment that we were like, we'll just try to get her a trach and see how this goes. Cause we were always, to go very like, we don't want a trach for her.
And that was basically the whole reason she was going through that was my fault, because we should have, if I knew what I knew now, which never stops, we would have just gotten a trait early and realized that she's going to need help breathing. Instead, my lack of being on either the black or white line, not being sure what we want to do with it, caused us to running into that moment. And that day I came home from work and Rose had called me and, said this, and I was a little more healthily desensitized a bit, just trying to kind of see what the situation was. Or I walk in the room and Rose is like, we have to do an emergency, what do we do?
Yeah.
And I had like 3 seconds. And I said, do it. And we got lucky, really, because when I said do it, we were months behind. So like, it really wasn't supposed to work. And Dr. Costa, being this just brilliant, handsome, emotionally intelligent gentleman, I love Dr. Costa and his wife.
Who doesn't?
He's just different.
He's doing well. I ran into him at Aldi's recently.
Yeah.
I would have died for that photo.
Grocery shopping with his kids.
Love that guy, man. He just treats his kids well too. He's just a great person. But he comes to us and he says his confidence in telling me it's right by an artery.
Yeah.
And that's another area where him and Dr. Tanios stood out, is that when it was time to be compassionate and there was 5 steps, they would give you those. But when it was 2, they gave you the look. Nobody said this would be easy, but this is where we are now. In the warmest way. Because sometimes if there's really only 2 options, it's too much emotions involved to just keep going. This is what we have. And when that was able to be done, they did that really well. And he had just brilliant confidence in himself to be like, it's right there. I think I can do it. And I'm like, do it. And there is a very happy 7-year-old human being sitting right next to me because he had that confidence, and because Dr. Tanios was able to be the coach between me and Rose and Lavender's like second mom to get us here. I can't even really take credit, believe it or not. That's why I like kind of sit here and I'm like, thank you for perspective. But there's a lot of perspectives. Imagine the doctors that were sitting there that actually placed that.
Yeah, once she got her trach, she was a totally different person. It was like that was whenever she was born. Then she started smiling really soon after. And then it was the plan of then going home.
Well, so I'll interject here. So I think, one thing now you're looking back and you're saying like, oh, I wish I would have done these things sooner. But most of my discussions with families, I want them to arrive to the conclusion themselves, because Aline and I may know this child's probably going to need this, but if we give you that information before you're ready, and you haven't walked that journey,
right?
Then
when the student is ready to teach,
then you may feel like you were forced into a decision. So I think it's better all the time.
That was very well put.
Yeah.
Because if that decision doesn't go right, then you feel like you were led into that instead of making it yourself.
And you did the procedure because you tried other things first, right? And you're like, we didn't do this painful procedure for no reason. We tried everything else. And so I think it's better when you make that decision yourself like you did. And so you shouldn't feel bad that, boy, I wish I would have done this 2 months before because maybe some of these other things wouldn't have happened.
And that's kind of where we, to wrap that up, I have a lot of guilt, but I'm going to pass it in a positive way.
Moms are supposed to have guilt. Dads, we're not supposed to have that, all right?
I have
I was born with the wrong sex.
Guilt, not dad guilt.
But what...
I think one of the coolest things at the hospital is like these people that just saved your baby's life, and then you're walking in the hospital with them, and then you just see them and they're going to lunch, and I'm like, you're a real person, because to us it's like you just did her surgery and you're eating fries. Yeah, it's
superheroes need lunch too.
Snackers.
Yeah, and they will
and they're normal people. It's weird.
The narrative of like doctors and nurses and dentists and professionals, and they're like, oh, well, they make a lot of money, and it's not like, yeah, but they work on Christmas. I say it to people all the time. I said, when I was in the hospital with my daughter, they were there with me as if that was my, I would always say, so the figure you're after, are you okay to work on Christmas? Because you're totally forgetting what they do and you're only looking at the figure. And I had that conversation often, and I wouldn't have had that had I not been, I was here on Christmas with her and like all these doctors, and like they don't have families and aunts and uncles and scotch and fruit and whatever they want to do to have a good time.
And for us,
Instead, they're sitting there right with me drinking like cafeteria coffee and what? Like,
No, I
some
mean,
of our best holidays really were though.
yeah, it's nuts.
absolutely. I was
first
thinking
year in the
about that
hospital,
actually.
yeah.
I was thinking about this today.
Tell us a story.
Yes. So I don't know how many of you know that Miss Rose is a seamstress, and she has dressed Lavender every single day, the month of December that Lavi was here, with a different outfit and different costume. I'm telling you, like, the whole hospital will need to pass by, not enter Lavender's room, but either take a picture or whatever. So I was thinking about that, how what just them just mentioned about working Christmas. And believe it or not, and I'm 100% sure that Mike concur with how we feel, like we both have kids. We also like to spend Christmas at home, but one of the most rewarding time coming to round for me, and I can speak on your behalf, that coming here, rounding on Christmas Day, it gives you different perspective. It keeps you grounded, and while the younger me would be like, oh my gosh, I'm working Christmas and my kids are little and all of that. Then you come to work and then you're like, wait a second, I get to go back home. My kids are at home and I can have the whole day, or I can spend Christmas the next day, or it's not like, but this is the family whose older daughter is spending Christmas by herself. Her mom is with her sister at the hospital. Her dad is going back and forth. So
it's ultimate sacrifice. And that's what I'm saying.
But at the end, on the other hand, it's also so, I don't know, fulfilling for us. And it's truly an honor. Like, I don't say it lightly. It is an honor. And you come in, and especially with Rose, like, you're coming, yes, I'm coming to check on Lavender and see how she's eating, how her breathing. But you know what? Probably I'm coming also to see what she's dressed up today. And that, yeah.
You know what really this started to? Whenever we went from the PICU to TCU,
yes.
And in PICU, you know, they don't wear clothes because you got all these cords.
Leads, yeah.
And then we get to TCU, and we had been there for a while. And I remember one of the young sweet nurses goes, "Is she always just in a diaper at home?" And I was like, can I get her dressed here? They're like, yeah, you can get her dressed in TCU. And then I was like, oh. From then on, we were like, oh, well, we're just going to make this as fun as we possibly can. So for Halloween and Christmas.
For Halloween, we both dressed up as, actually, Rose asked me, what are you going to be? You know, in pediatrics, we dress up for Halloween. So I was dressed as Snow White. And sure enough, Lavender was a Snow White, a beautiful Snow White.
So perfect.
So we did Snow White and the
who
seven
wore it
nurses.
better?
Oh, I mean,
It was a tie.
I was here, she was like there.
Yeah.
Well, I was thinking something earlier. Aline had mentioned this. You know, we were talking about journeys and the journey you guys have been on. And I don't know, I'm sure you remember, Aline, when you're a trainee, you work almost every holiday.
Absolutely.
And you feel bad for yourself and you're resentful. And then somewhere along the line, you transition and you really, like, I don't feel resentful about working holidays anymore. You know, my kids, I wonder, do I have to wait until you get home to open gifts? I'm like, yes, but you get to open them, and the kids I'm going to see are not opening gifts today with their family. So, and so usually they're like, oh, and then they just eat their cereal quietly. But it's a journey. Well, good question.
But you know, for Lulu too, because she had turned 9, but she has such good memories. Like, I know a lot of people are like, oh, the siblings in the hospital too. Like, Demetrius would literally go to work, leave work, go pick Lulu up from school, bring her back to the hospital and go back to work. So she was here every evening with me. And just, she loved going and getting her little tea. She still talks about it. She's like, oh, the Cardinal Glennon tea. And we would go to, like, for her, it was so much fun. And she knew all the nurses and the doctors. So even like holidays, she had such a good time being here. It's not a sad, like whenever we pass it, it's not a sad thing for her.
So yeah, so I want to rewind a little bit. Okay, so we get our trach. I think you said she was like a new person.
Mm-hmm.
So it's like you're starting over all again. So you are starting over, but you got to go home now with it. So take us from we got it to the things that you needed to be equipped to handle.
Yeah.
And how you got through that and eventually went home for the first time after that.
So she got it on her 9-month birthday. And then we went home on her first birthday. I was like, my mission, like, that would be so magical. You know, if we went home on her first birthday, we got to surprise everybody. So we had a lot of training during those times. And then once we got home, I feel like it was really scary before she had her trach. Like, a lot of people would be scared to bring all the things home. But to me, I felt like I knew all these things about her that I didn't know before. And we had these ways to support her. So then once we got home, yeah, it was really like, well, we stayed in her room for quite a while.
Plus, with the prior to the trach, if she got sick, we had to go to the hospital immediately.
Oh yeah,
with the trach,
there was no.
Which is weird because we were literally looking at the trach in a negative light.
But I don't think that's unusual for non-medical people, because as a medical person, I would be intimidated as HE double toothpicks to take my child home with the trach. Yeah, I mean, for real.
Well, I think they're so scary before
for sure
your child has one. And that, you know, and I remember just crying before she got it, like, I'm never going to hear her voice. And that's just not how it is. They can vocalize. And once she was able to gain weight and just actually start living her life. And I remember Dr. Costa said that, like, once she's not so focused on breathing, then she can start playing and doing all the things. And that's really how it went. So once we got home, she just started growing and playing and like reaching for toys, things that she had never done. And yeah, it really wasn't intimidating. Like, I would just put her right in the cart with her ventilator and all the Target groceries. And it was like no big deal.
That was a big deal.
It wasn't 100%. To me.
She made it not, and I applaud her for that, because at every step when there was a big deal, she made it not a big deal. So like,
well, that was what was holding us back from the trach, was that we had another child and that we still wanted to be able to live. We didn't want to originally. We don't want to live a life in the hospital. You know, we want her just to have this great life. And then it was when she got the vent, we're like, oh, we're never going to be able to do it. But we did. She went to the zoo, went on vacation, and we've done all these things while she had a trach and a vent. And
so how did you get there mentally, I guess? Because it's scary, right? And I want you to give yourself and just your own faith and your own personal development credit. But how did you get from, okay, is this even possible? Like, did you have people along the way, be it other moms, be it caregivers, that said, oh, no. Like, you can do these things. Like, you are portable. Like, you are, you know, you can live, you can do these things. So carry me through that a little bit.
I think being in the hospital, you make friends with all the other parents too. And you're walking past the rooms and all the kids have trachs and vents. So you're like, oh, and they're all doing, you know, they're doing all the things. And really just seeing how happy she was, that she wasn't just like sleeping all the time or sick.
At this point in previous, maybe like she's 7 now, but maybe when there's probably a little bit of a chip on our shoulder of like, she wasn't supposed to do this, she wasn't supposed to do that. So now we make sure that she does, like, you know, just going to Target, does things that like every other baby can do. And so that families like ours can see that, like, your situation may not be like ours, but it may not be what you're thinking either. So you never know, but it's possible, you know, depending on who you are in your situation, but it's possible, like, for a baby with a trach and a feeding tube and this and that to be at the zoo, like looking at the lions.
I want to talk about nuts and bolts a little bit. So we go home, you're managing a lot at home. What are the nuts and bolts through complex care? How do they help you navigate things? Whether it's coordination of appointments, whether it is just, you know, coordination of services, whether it's them being available to you at a certain level for your needs. Talk to me about what were some of the highlights of how the program and its existence helped you as a mom navigate her stuff.
Yeah, like, well, and even those months after the trach too, when you're really becoming like family with everybody and they're teaching us, you know, there's like a checklist, like, if you were at home, what would you do? Like, if we weren't in the room. So yeah, with complex care, you know, it's all her specialties just in this little, nice little organized, you know, bubble for us. And yeah, they've just made our life so much easier. Like I said, they're like our little personal planners. And I was trying to think, did we start seeing you when she was about 3?
Yeah, I think so.
Okay.
Yeah, well, I'll say one thing that, I mean, I'm sure Aline and Dr. Sobush or Aline and Kurt talked about this the other day is, you know, putting myself in my non-complex care role as a pulmonologist, right? Like I'll see someone in clinic and I'm very uber focused on a pulmonary system. And, I may not see all the other specialist notes. And when you do complex care, you take a step back and really it's like, oh, hey, well, so-and-so's thinking about doing this and this other specialist thinking about doing this. And, they help with that cross specialty coordination. So everyone's on the same page, I think sometimes too. And I think that's really where the programs, like one of the many strengths of the programs is like, it just, it's like, hey, ENT's thinking about doing this and surgery's thinking about doing this. Maybe we should talk to these teams together and get them on the same page. Right. And so I think, and then versus me as a lung doctor, I mean, that maybe I'm focused on something else when I go into clinic. So.
And a lot of things are connected too, though. Like I never realized like her like tummy issues were also like breathing really, all these things that they taught me that were connected. So a lot of times, like you said, like they overlap.
This level of care and coordination and support that the complex care program does, I mean, specifically even for you all, why would that be, or not why, we think we know why, but how is that necessary? What does that mean to you all given the circumstances?
Complex care is really exactly like it sounds, because it's very complex, sincerely. So if it wasn't, and let's say we had to go to a doctor or a different department for a trach or breathing, all of these things would be 5 or 6 different specialties that are all locked in one. And that makes it a very difficult situation less difficult for us due to someone willing to do the work and have the knowledge and understanding to take something that is extremely difficult to understand and all this and have it to where it can be fed to a toddler, which is how if you're really smart at anything, that's how you want to be able to give it to anyone. And we were lucky to kind of get that. And even now, my wife knows 1,000 terms, just words and different things that she's picked up in different ways. And we picked all of that up through complex care and different ways of being able to communicate. Go ahead, baby.
You can tell I want to talk.
We've been married for 20 years. I think I got an idea.
Whenever you just said that, I thought, yeah, every time a new medical mom says stats, I'm like, it's sats. Saturation. But anyway, no, with complex care too, I think instead of just, any discrimination towards like a diagnosis, they're not just looking at the diagnosis. Like I was saying earlier, it's the individual, like, yeah, and I think they've said that to me too before when I would be like, oh, well, so-and-so. And they're like, just because they both have trisomy 18, they're so different. Like Lavender, doesn't have a heart defect, but she does have breathing difficulties or, all these different things. So I think the fact that they just narrow in on like, oh, this is what we need for her to thrive. And and it clearly works.
Well, one thing I learned really early on in my medical training, like when I remember this from my intern year, a child that had a bad prognosis, and I just asked the attending, I said something about like, what is this prognosis like? I was a baby doctor, right? And he said, it really doesn't matter. He's like, to this family, this is their child, and they have like, these are their outcomes, right? And so when you talk, earlier, going back to like the old OB appointment and all the numbers, and like, it really doesn't matter because those numbers don't apply to Lavender, right?
Right.
Like, so I that was something I remember learning 20 years ago, and that's always stuck with me about anything, even how I even approach, like how I thought about how to approach my own child if I was in a situation like that. So I think that's what you're highlighting. I'm just saying it a different way. Mm-hmm. And we're both using stats correctly.
I'm going to ask you guys a question, and then I'm going to ask you guys the same question. So
ask them first. Yeah.
Yes. To get some. Yeah, for sure. For sure. So to the two of you, if there was a wish list, or you could make you're very complimentary of the complex care program, and I understand why, but if you could make it better, you've been through it, the resources you have had, but maybe this would be good too. Like if you had a magic wand, what is something that you might think could be an addition that could make the program even better for families?
Man, I don't want to duck this question.
We talked about this.
Clone Dr. Tanios and Dr. Smiley, or build like 8 or I don't know 50 other Cardinal Glennons in every state.
Yeah, if only you guys could be in other states. We talked about this, and we were like, we really can't think of anything because we love Dr. Smiley and we loved our time with Dr. Tanios, we really can't think of anything.
If there was a way for me to encourage more families to give it a chance, that would help.
Yeah.
That's it.
There we go.
Yeah.
Aline has lots of things that I can think of.
I got it. Oh yeah, you guys are the experts.
We're very hard self-critical.
Yes,
You go
we
first,
are.
Aline.
You sure?
Yeah. I think I know. Maybe I should go first. I think I know what you're going to say. But you go
No,
first.
I'll go first.
Yeah. Now I have to think of a second thing.
I think I look at it from different angles. So from a family standpoint, what I would like them to have in complex care is a one dedicated large space with access, better access to the facility itself, better access 24 hours 7 to the staff, which this is the program that we don't have yet. We would love to have. Dedicated team on the inpatient side. So if they're admitted, they have like some kind of continuity. But I also would love to have to establish some kind of home visit, especially for the patients who are newly enrolled, where they need a lot of hand-holding. And I'm assuming, and I'm 100% sure that Rose would have loved to have someone who she knows, she trusts, who can visit, just to provide this kind of reassurance, validation of her fears. Yes, she made all the phone calls. I mean, she's a trooper, that's for sure. But that kind of extension of both the community, the clinic, as well as the inpatient, creating that continuum is huge. But that takes also, you need a lot of funds. And then I don't think it's going to be difficult to recruit passionate people because once you're part of complex care, no matter where you go, it goes with you. I mean, till now, whenever any of the complex care patients, whether I know them or not, now if I know them and I know the family, these are mine. And I don't share. I had to share Lavender though. But
You left.
Don't remind me.
But so this is what I would love to see.
Okay.
So I agree with Aline about definitely it would be nice to have an inpatient complex care service for the continuity from the inpatient, these patients, as they probably talked about in the earlier session, are at higher risk of admissions and things like that. So it'd be nice to be able to bridge that, have that continuity presence, because sometimes our patients may end up on the hospital service with Dr. Tanios, or they may end up on the pulmonary service with me or Dr. Sobush. And there is a little bit of a disconnect there, even though we're all part of the program. So it'd be nice to have that piece. I think the other piece that I think would be nice, and this is going back, I think if families knew what sort of programs were available when they were at certain critical decision-making points in their child's healthcare journey, they may make different decisions because of the supports that exist. So I think just that greater awareness about what the program offers, and then also some information about families that are part of it. So I think families might be that making those decisions that are really scary, like you talked about earlier, like the tracheostomy and stuff, ventilators, I think that having those families realize about those resources early on, whether it's in the NICU, like a lot of our Trisomy T patients may end up in the NICU very early stages, just having those things, or even, early on in prenatal counseling, potentially in a child who will most certainly may be eligible for the program in the future. So I think that would be like the next step, so families feel more supported. And then finally, it'd be great to clone Aline and I agree with you. However, I will say all the providers but all the providers in complex care, we're all very different in our approach. Aline and I are similar. I think we both use humor as a way to connect with our families and to humanize and to help with stress management. And I think our nurse practitioners and the nurses do a really good job of pairing up families with, like, hey, I think this family would connect well with you. It's not accidents a lot of time about who ends up with who. Hey, I think this family would appreciate a little bit of your snarkiness and sarcasm, Mike, and that sort of stuff. So I think they pair us up like that, and so I think and we don't want us to all be the same. But that's a nice compliment. It's probably the nicest thing I'll hear from anyone today, because I
mean
guarantee
it,
you my 16-year-old will not say anything that nice to me when I get home.
No, but Mike is 100% right. It's when our recruiting team meet some patients and their families, they can see we're so different. Everybody has their own style. Some family may not like the direct approach. Some family would prefer giving them more time. Some prefer you pushing them to get the decision done. So we were fortunate, whether Mike or I, to match really well with Lavender, Rose, and Demetrius, because I think we were working at the same pace. We both, I mean, obviously not the first day, but after that, we knew they knew what to expect from us. We knew what to expect from them and what they want from us. So my main interactions was with Rose, especially on the inpatient side. In clinic, I talked to both of them at the same time. But usually on these hospital days, it's like, okay, Rose, we're doing 1, 2, 3. Anything else? Do you think we should ask so-and-so to come? Yeah, why not? Add it to the list. So before we leave the room, we have a solid action plan. And then if Rose is worried about, or we're worried about another complications, we say, okay, let's have a contingency plan. Plan A, and sometimes we joke, I'm like, are we going to have plan Z too? Like, but some people do not like these kind of complex kind of plans. Some people like, tell me just plan A and let's leave it like this. I think we function more like, this is plan A. However, to provide Rose reassurance or Demetrius more sanity, you would say, no, hey, we have plan A, we can have plan B, but should this goes, because again, we always say, at the end of the day, it's Lavender who's running the show, not them, not us, nobody else. So we really, I say, they're doing their part. The staff is doing their part. Lavender has to do her part. She cannot just sit there. I mean, right now she is like a diva, but.
and I think what Aline is highlighting is the nuance. Like, people want black and white answers, and I think you guys are both very good with reception to nuanced answers. Like the discussions we've had in clinic, it's rarely like this is the right answer. Mm-hmm. There's always nuance to it, and you guys do a good job of embracing that. And I wish makes our job easier.
Dr. Smiley, one of the things that you mentioned kind of on your wish list is you wished ultimately that more families would have kind of access to these resources and kind of know that these things are available, right? And I reflect back to like the trajectory you guys were on was a hospice path, right? Mm-hmm. And then all of a sudden, boom, we get sick and now we're talking about intervention. So something like this, a program like this would not have been introduced to you sooner. So I probably should have asked this earlier on, or even asked Dr. Sobush when he was here. What is the current process for introducing a program like complex care to families? Like, how do families find out about you? Because I do think about that. Of course, we have to talk about the program's bandwidth and how much you can absorb, because I don't know, I'm a mom that I would rather know about you and not need you, but know that such an animal exists, right? Mm-hmm. And correct. If I get to that point where it's like, you know what, I'm feeling like I could use some extra support. Yeah. Somebody told me at one point about this program, like yes. You want to get it in people's heads and in people's arsenal so that they have knowledge of you, right? So what's the current process of like people finding out about you, right?
Yeah. Well, right now it's referrals only. I mean, right now it's based on referrals, and Dr. Sobush has done a good job of, especially having the nurse practitioners, Beth and Emily, go out into the community, meet with like local primary care physicians, so pediatricians, family practice doctors, nurse sure. practitioners, and educate them about what the program offers. But that's just part of it, right? There are so many different ways that you can enter the healthcare system. I mean, you entered through hospice, mm-hmm. right? Like that's not for instance, our footprints team probably would have, I think footprints probably would have, we work with them a fair amount, and they probably would have thought about, this seems to be going a different direction, and maybe we should introduce you to complex care. Maybe goals are changing here.
Mm-hmm.
Or even had that discussion before about like, hey, are you familiar with the resources this program offers? So I don't know what are your thoughts, but yeah, it's hard for us as a program to know. We don't know what's out there if we're not told about it.
Of course.
No, I mean, that's very true. So there's 3 ways to be involved from early on. The first, as Dr. Sobush mentioned in the previous episode, that your main age group is younger than 5 years old. If you want to even narrow it more, it's your premature babies. So what has been done in the past is that our back then we had Mary Howell and Aaron Hooper, who would go to the NICU, visit with these families, and before they visit with the families, they would review the charts, check if they meet the criteria, the enrollment criteria we talked about, and then visit with them. So by the time they're ready to be discharged from the neonatal unit, they already have a schedule, an appointment with some of the providers in complex care. And this way, these families have a plan in place, which is huge. So that was and still the main referral stream.
Okay.
The second area would be the community physician, but the community physician are going to know about patients with complex condition after they're born and after they've visited them in clinic.
Sure.
So if this is like Lavender didn't go and see them until she got sick. So you're missing that 2 months gap, for example. And then the third one is the patients who who come to the ER. Those can be, we've done an amazing job, and our ER team has done excellent by when they see patients who have who have complex condition and they meet the criteria, they flag them and then they reach out again. Is it done consistently? Probably not, depending on how busy they are and all of that.
Sure.
But on the floors, we do also a good job by screening who can be referred, and we'll call immediately. We will be rounding and say, you know what, this patient qualifies. Let somebody come in. Sometimes they come to their room. Sometimes they will give them a call later after discharge. So you're trying to cover, a big radius from different areas. So again.
So maybe this is a bonus with you being on the inpatient
Oh,
side
yeah.
right now for your future goals.
Oh,
Who
yeah.
knows?
Yeah.
Yeah.
I think it kind
Complex
of
care pipeline.
I think part of it
word
too,
of mouth
Yeah.
is what does it.
Well,
Yeah.
family testaments is
Yeah.
huge because there are a lot of families who the program gets brought up to, and then the answer is no. I don't. There's a lot of automatic no's without. As I tell my own children,
From
I'm like,
families.
you never say no to information, right? Like if someone wants to tell you about something, just never hurts to hear anything. So that's usually myself. If family says, I think we're good, I'm like, well, we're in the hospital today. I'd like to keep you out of the hospital. So maybe you can meet this resource that may help facilitate that. So we can just see you in clinic and not in the TCU, right?
Sure.
So I usually tell them, at least I usually ask them, just do me a favor and hear them out. And then sometimes that works and sometimes not. But I think family testaments and things like that are huge.
Well, you guys, I have to say, I mean, as we kind of start coming to a close, we might take a while, but we're going to start coming to a close. But Rose and Demetrius, you guys have been generous to share your story in different venues before. And each of you have made comments that stuck with me. And I kind of wanted to share a couple of those past comments you've made as we close out here. And Rose, I remember you saying that the staff at Cardinal Glennon saw Lavender for what she could be versus what the odds of what her diagnosis told us. And I just want to say amen to that because heck yeah, look at her, right?
That was really
And-
special, though. It's hard to see the invisible.
Yeah.
Mm-hmm.
Yeah. And Demetrius, you said, life is what you decide to make it. It doesn't have to end with a diagnosis, which we learned and had to practice. And I just have to applaud you both for your faith
I meant
and
that.
for,
Yeah.
for your trust in us which is huge, for your choice every day to live your best lives, which you so do. And
being able to pass your strength on to other people who are willing to listen and absorb your story.
And I want to say thank you to you, Dr. Smiley and Dr. Tanios, and for all that are part of your team, and for those like Dr. Sobush who, joined us earlier to pioneer such a great program that truly, truly, truly empowers families, right? And allows families not to be so overwhelmed and actually look at life through a lens like the two of you do and can now. You are all a healing presence as far as I'm concerned for those that need you. And I really hope that through sharing more about this program that we're teaching those who aren't informed and some other people who really need us.
Thank you so much.
We hope you enjoyed this episode of The Glennon Factor. Make sure you follow The Glennon Factor and leave us a review wherever you get your podcasts. Visit Glennon.org if you would like to learn more about how you can support Cardinal Glennon kids. And while you're there, feel free to share any feedback or episode suggestions on our podcast page. The Glennon Factor is recorded and produced by SSM Health Cardinal Glennon Children's Foundation.